Dentistry and obstructive sleep apnea. What is the link? Traditionally, we thought that grinding and the resulting broken teeth, fillings, and crowns were the result of stress. Stress can play a part in clenching and grinding, as can certain anti-anxiety or antidepressant medications. However, there is another major player in causing tooth damage from clenching or grinding. I have started asking each person when I see damage of acid reflux or grinding if they also snore. To my surprise, I have found that at least 80% of people, this is anecdotally, say yes. This then leads me to suspect an airway issue, and more sleep apnea screening questions will be asked. The simple follow-up question of "do you feel refreshed in the morning" is often answered first with a pause and then a no. It has become clear from several studies that the movement of the lower jaw in a forward position during sleep is a result of the body trying to open the airway during a sleep apnea event. It is just after the obstructive event has occurred that the lower jaw is brought forward in an attempt to bring the tongue forward out of the throat and as a result open the airway. This is usually done with an activation of jaw muscles, causing an increase in pressure of the teeth together. Dentists see the effects on the teeth of clenching and grinding with broken teeth, broken dental work, sensitive or sore teeth for no apparent reason, headaches and jaw pain from jaw muscle activity or overactivity, and the effects of grinding with shortening of the teeth. I have even seen dental implants being bent and healthy teeth needing root canals from the pressure on these teeth from the clenching. We also see the effects of chronic acid reflux on the teeth, which is first seen from the insides of the top front teeth. Acid reflux is a common side effect of sleep apnea, where the pressure in the thorax causes the pyloric valve to open and acid to go up the esophagus. We see this in the throat with increased redness, and people report taking antacids or it wakes them up at night. Another possibility is something called silent acid reflux, which is where people don't typically feel the burn associated with acid reflux, but we see the redness. This is a result of the fine acid mist that comes up to irritate the tissues instead of the liquid acid from the stomach. Chronic acid reflux is a problem because it may contribute to esophageal cancer, so it's not as benign a condition as people may think. Just like snoring, which chronically irritates the throat and increases people's risk of developing sleep apnea. People generally don't see the insides of their top teeth, but they may notice a see-through edge of their top front teeth that starts chipping over time because it has been thinned out. The same effect can happen just from grinding your teeth, where the damage starts from the inside and goes outwards. Also, traditionally, a night guard would be made to protect the teeth from the damage of grinding. However, I always caution patients that it does not stop the grinding, it just protects the teeth from the effects of the grinding. Today, we know from studies done on people with sleep apnea that wearing a night guard can actually make the sleep apnea worse in 50% of the people. The reason is because the night guard opens the jaw and places it in a worse position so that it cannot be moved forward and out of the way. We also know that sleep apnea can contribute to anxiety and depression, which then, when treated with medications, can certainly increase damage of the teeth because these medications also have bruxism or grinding as a side effect. The nice thing about oral appliance therapy is that the appliance also acts as both a method of keeping the jaw forward as well as keeping the teeth separated and protected while you sleep. Hopefully, the improved breathing means there will be less clenching and grinding and maybe even less headaches and less damage to the teeth, of course. But results vary, and we cannot 100% guarantee that you would get less headaches or less jaw pain from wearing the sleep appliance. I find the topic of sleep-disturbed breathing and everything sleep-related so fascinating, and I feel fortunate that my profession can offer an alternative solution to help people sleep better and protect their teeth at the same time.